this is, I want to talk about masks for just a minute, because this continues to be very important. And I'll just say this, I hate wearing a mask, but I'm going to do it. And everyone should think about it. And to be frank is, I don't think our elected officials have done us any favors, because they could have positioned the wearing of masks as a patriotic act, as something that we could do to benefit each other and our fellow Americans. But unfortunately, it's been used as a political wedge when it shouldn't have been. And the fact is about mask is that when I wear a mask, it doesn't necessarily help me, it helps you. And when I think about it, look, I don't like getting a colonoscopy either, but when I get a colonoscopy, it benefits me. But when I wear a mask, it prevents me from spreading coronavirus to someone else. But most of us think that we're not going to get it, and we don't get sick until we do. The importance of wearing a mask is to prevent us from making other people ill. And the fact is if we wear them, then it lessens the spread of them. And the challenge that we have now is in counties where they don't have mask ordinances, is that people are choosing not to wear them. If you go to Brazoria, if you go to Galveston, if you go to Montgomery counties, you'll find the usage of masks in my stores are about 30% or less. If you find in Harris County, Bexar County, Travis County, Dallas County, you'll find 90% of customers are wearing masks today. And I think we're going to find is we're going to need to wear masks for an extended period of time, because from what I've read on this is we aren't going to find that COVID-19 is going to dry up and go away over the course of the summer. We're going to have to deal with this through the summer. And if it acts like 7 out of the 8 last flu epidemics we've had over the course of this last century, it will come back with a vengeance over the course of the fall. So masks, unfortunately, become a reality of something that we have to deal with. So Usama, I would just throw it back to you and see what your thoughts are on it. But masks are an unfortunate reality. And for my partners in my stores is it becomes part of their uniform.
Well, Scott, if you don't like your current job, I'm ready to have you over in our public health organization, because you're speaking exactly the facts that I understand, and you're articulating the rationale, the use of masks in exactly the way that we in medicine and public health understand them. So I couldn't say it any better. And I would just say really congratulate you for seeing the evidence for what it is and for seeing the necessity. I mean, let me share very personally, I hate masks too. Whenever I'm seeing patients, I either have to wear the surgical ones or the even more awful N95s. And I've developed little cuts and bruises on my nose, and don't cry for me. I signed up for the medical thing, but we get no pleasure out of recommending that people wear masks. But the other thing that you said is critical, which is it is a patriotic, communal responsibility to wear masks, to protect the people around you, to protect your communities. It is amongst the best things that you can do, because again, it's not really as much about protecting what's come toward you, but really your speech, your cough, your sneeze is going out. And I think one of the critical parts of our ability to get through these next waves across our 50 states is going to be to able to have a conversation amongst ourselves. Let's depoliticize it, because public health isn't on the side of one party or political spectrum or the other. It's everybody's shared resource and responsibility. And let's just have a conversation that says, we want to protect your workers, Scott. We want to protect my fellow healthcare workers. We want to protect your families. We want to reopen the economy. We all want the same thing. Masks, testing, tracing, and distancing, that's the pathway to do this.